As a new employee of Alliance Therapy Services, it will be helpful for you to understand your roles and responsibilities as a therapist with the company. This video will outline what a workday should look like for an ATS therapist. To begin, it is important to understand how things work at ATS. ATS works with a number of home health agencies which you will become familiar with over time as a member of the ATS team. These home health agencies send referrals for patients needing PT, OT, and ST services. When these referrals are received, the patient's name, information, and certification period are added into Kinzer by the ATS office staff. Evaluations are then scheduled out to the appropriate evaluating therapists. The evaluating therapist will then either see the patient for the initial evaluation, or in some cases, will be unable to see the patient due to various circumstances. If the patient cannot be seen for an evaluation, the home health agency and ATS office must be notified. In most cases, the patient will be seen for the evaluation. The evaluation is then documented and submitted to the ATS office staff for approval and scheduling. All scheduling and billing will be done by the ATS office. All patients that are scheduled to you will be available in your hotbox. Please keep in mind that schedules for the following day are subject to change until 6:00 p.m. Due to this, we ask that you please wait until the day before your scheduled appointments to verify any specific days or times with your patients. If a patient requests to be seen on specific days due to doctor's appointments, chemotherapy, or other conflicts, please communicate this information to the ATS therapy coordinator so the visits can be scheduled accordingly. Otherwise, you will want to call and schedule your patient's visit times the evening before. You will first want to pull up your schedule for the following day. You will there have access to patient names, addresses, and phone numbers. It is suggested that you take a few minutes to route your schedule before calling patients. Routing your schedule simply means that you plan out the order in which you will see patients in advance. You can do so manually or by going to routeexcel.com. If you have patients that you know must be seen at specific times, you may find it easier to decide on the order in which you will see your patients without the use of RouteXL. However, you may find it useful to use this tool as it will give you the optimal time-saving route using all of your patients' addresses. Once on the RouteXL website, choose Import. You will then input each address into the box. The addresses must be listed as you see here with cities and zip codes. Once you have input all the addresses, you can then choose which location you wish to start at, as well as where you would like to end your day. Please note that choosing where to start and end your day is optional. Now choose to Find Route. This will give you the shortest, time-saving route along with directions to each location. You may not always be able to go in the specific order since your patient may not be available at this time, but it can give you a good idea of what your day should look like. Once you have decided how you want your day to look, you then need to call your patients to set up times as well as confirm that the current address in the patient's chart is still accurate. If the address has changed, please record the information in the details of the visit so it can be updated by the ATS office staff. When it comes to setting times to see your patients, it will be beneficial to you and your patient if you avoid setting specific times such as, "I will be there at 9:30 a.m." Instead, give a time frame such as, "I will be there between 9 o'clock and 10 a.m. Since there may be unforeseen circumstances that can keep you from getting to that patient's house at an exact time, this will help to avoid any frustration for you and your patient. Once you have called all of your patients and set up time frames to see them, your next step is to access the necessary information before seeing the patient. If you are an evaluating therapist, you will have information regarding patient diagnosis and medical history available to you in the details. If you are going to see a patient for a visit, you can view the evaluation for the patient by going to the print preview next to the date that the evaluation was completed. This evaluation will give you the patient's treatment goals as well as the name of the evaluating therapist. Once you have the necessary information, you are now ready to see patients. Once you have completed a patient visit, you need to complete your note, then submit that note to the ATS office. Your note will then either be submitted or returned to you if there are any corrections needed. The next few videos will go over different types of notes and what is needed for proper documentation.